present with the pain in the abdomen.
Okay, how long has she had the pain in the abdomen for?
For 3 days now.
And where exactly on the abdomen does she mean? Upper abdomen, lower abdomen?
The lower abdomen and also close to baby button.
Okay.
Was there anything that you ate or drank that started it, or anything that you did, a cause, when the abdomen pain started?
Not really. It happened all of a sudden.
Okay. Have
And
you got any associated, sorry, Ange?
there you go.
Any other associated symptoms, nausea, vomiting, diarrhea, constipation?
Constipation.
And the type of pain that you're experiencing?
It's difficult to describe. But feel bloating. The abdomen is full.
Is there any burping or hiccuping?
Nope.
And what would you rate your pain out of 10?
It's about 3 to 4.
Okay.
Has this ever happened before?
Nope.
Have you taken any medication for your abdominal pain
No.
or seen a doctor? Have you been sweating? Any perspiration?
Nope.
And if it started 3 days ago, has it been the same for all 3 days, or is it getting progressively worse?
It's similar.
Similar. Okay.
So just to go back to Tammy's question, when you ask sweating, what do you think in your brain? I mean, when you ask this question, when you ask that the patient sweat,
What am I thinking?
or in other words, if I say yes or no, what this answer
Does
can
it tell us?
help you? Yes.
The perspiration could indicate possible fever, and also sort of leaning towards any sort of heat syndromes or any heat opening the pores.
Not really. So even fever, the patient may sweat or may not sweat.
Okay, yeah, they might feel hot, but yet have no perspiration either.
Yeah. So basically, if you want to ask sweating, probably you will ask at a later stage after you get all information if you think this is due to heat or due to qi deficiency. Then you can ask these to confirm.
Yes.
Okay.
Yeah.
And is your skin hot to the touch, or do you feel warm or feverish?
It's normal, feel like.
Okay. Have you been feeling cold or chilly?
Nope.
Is there anything that makes the pain better?
Not really.
Is there anything that makes it worse?
Also, I don't know what makes it worse. It's come and goes.
Okay.
And the patient's tongue?
The patient tongue is a red tongue with some yellow coatings and slippery pulse.
Doctor Who, is this patient on their menses?
Nope.
Okay. The energy levels?
Not too bad. 5 to 6 out of 10.
And the patient's complexion, facial complexion?
Is normal.
Okay. I can't think of any.
Has the sleep been affected by the pain? Does it stop them from going to sleep?
Nope.
Appetite?
Poor appetite.
Thirst?
Normal.
Okay, on examination, if we examine the abdomen, and we put pressure on the abdomen in the different areas, is there pain in a certain area and does it go somewhere on pressure?
All negative.
All negative. Okay.
Is blood pressure normal?
Normal.
So all the vitals are normal.
Mm.
Okay.
Does she have a bad taste in the mouth?
No.
I can't think of anything else to ask him.
No,
You guys think of anything?
Yeah.
He's just being patient there.
No.
Can't
So,
think
so next time in the clinic, you should come to me within 5 minutes.
Yes, this shouldn't take long. Okay.
Oh, my.
I can't think of
What did
anything
Dr.
else.
Hu say? Sorry, it cut out there.
I said
he's
in the
saying-
clinic, you need to come to me in 5 minutes. Don't use 20 minutes for your consultation.
Yes, this should be quick.
Yeah, you can achieve
Okay.
if you answer these questions specifically, you can achieve in such a short time.
Hmm,
Okay, I'm going to leave you
Okay.
for discussion. So basically, you need to tell me, similar to before, for this case, it's quite simple, straightforward. But what we want to ask you to do is the differential diagnosis and also the prescription.
Okay.
Let's see, try to give you 15 minutes and see if you need more or not. 10, 20, we can start at 25 or 20 or 25. Just when you're ready, let me know.
Perfect.
Okay.
Thank you, Dr. Hu.
Thanks. Okay, so there's definitely heat going on. Do you agree?
Say again, Angie.
I
Definitely.
said there's definitely heat because of the thin yellow coating on the tongue and the red tongue.
Yes.
Yeah, red, yellow coating, and then the slippery pulse also can be all excess heat.
Yes.
Yes.
And he's constipated. She's constipated as well.
It's also heat, yeah.
Yeah.
Okay. Could this, as a differential, be food retention, or do you think that it is food retention? Is the bloating? I'm not sure. And bloating is not specific.
Yeah.
I did say constipation. That could also be.
Yeah, the heat.
differential.
Okay. Another differential diagnosis would be appendicitis, but we would rule that out because of lack of Murphy's sign and not Murphy's sign,
Yeah, no perspiration,
one.
sweating, nausea, vomiting.
there's no sensitivity in the right lower quadrant.
Quadrant, yeah.
Okay. Do you have any other differential diagnosis for stomach ache? Can be
So differential for stomach ache, obviously acute abdomen is number one to eliminate acute abdo, like you said, cholecystitis,
yes.
appendicitis. They would then have probably sweating, feverish, nausea, vomiting.
Yeah, pain would be
etc.
much more intense and would have increased, I would think, over 3 days.
Yeah, and almost acute emergency. And then acute abdomen, I suppose a differential could possibly dysmenorrhea, except
Yes.
she does not have a period.
Yes.
That there's no period. Also things like maybe IBS, Crohn's disease, diverticulitis.
Yeah.
You know, I would say IBS or some sort of colonic pathology.
Yes. Crohn's.
Yes.
Or celiac or one of those.
Yeah.
Okay. All right, but with celiac Crohn's, they tend to have diarrhea.
Yes.
IBS
can go between both.
between both. So at the moment she's only constipated and it's only been for 3 days. So all of those, IBS, diverticulitis, all of those would be more chronic.
Yeah. Malignancy is also important, I think, in terms of any abdomen. But then I would say probably more associated with weight loss, poor appetite, changes in bowel habits, black tar in stool, things like that.
Yeah, and it
or
also would
bleeding
have been for longer than 3 days. Yeah.
longer than 3 days. Yeah, more sort of chronic.
Yeah. Okay. And then in terms of diagnosis, we're obviously going to say, is it abdominal pain is the...
Abdominal pain, yeah, in terms of Chinese diagnosis, abdominal pain.
And then we're going to say what?
And then I would, what, in terms of syndrome?
Yeah. Because
I
I mean,
would say, yeah. I mean, just from the tongue and the pulse, I would have said, I would just say excess heat.
yeah.
Excess heat. There isn't any specific organ that's pointing, because for abdominal pain, it could be food retention, but that would have a slippery, greasy, thick coating. There would also be vomiting, diarrhea, foul breath, putrid, yeah.
Yeah, so I would also say I would rule that out. So, I mean, excess heat to me makes the most sense with a red tongue, thin yellow coat,
Yeah.
slippery pulse. I think that's all
Yeah.
heat symptoms.
There's definitely not cold. There's not related to any sort of cold food, etc. So it's definitely not that. And then the other one, the more common one, was a spleen yang deficiency, but also doesn't indicate that either.
Yeah,
there's none of the
yang
so,
deficiency would be cold. So
yeah.
Yeah.
So I would say I don't know if you girls agree. I would go with excess heat.
Yes.
For early stages and abdominal pain.
Yeah.
I think we're okay with our differentials.
Yes.
Unless you guys
Then
have more suggestions.
With points, I would say RIN 12, probably stomach 25 because you're complaining about pain around the belly button and there's constipation.
Sanjal 6 was good for constipation as well.
Yeah.
But if there's heat, like you say, possibly more Sanjal 5 would be a safer option with the heat.
Okay. And then obviously stomach 44 for heat in stomach. But I mean, that's stomach specifically. So I'm not, but I mean for heat.
Yeah, that's more upper abdomen, no? More
Yes,
for gastric irritation. Yeah. So this seems to be more lower abdomen. A ring 12, ring 4 would also be good. Ring 12, ring 4.
Yeah. Okay.
Ring 12, ring 4.
And stomach 36, if we're talking about general.
Yes. Or general digestive problems.
Yeah.
And then, like you said, stomach 25, which is super. And then we obviously have to do stuff to clear the heat. I would say large intestine 11.
Yes.
And maybe Sanjal 5 as our sort of distal points.
Stomach 44.
Yeah, I also thought stomach 44, but Tammy was also saying that's more for actual stomach heat rather than abdominal.
Let's have a look quick. I'm going to quickly check. Let's quickly have a squizzy.
Unless it's food retention, but you know, it doesn't. There's none coating for that, I don't think.
Let's have a quick squiz because it is Young Spring water points. It clears heat from the stomach channel, alleviates pain. So we could possibly use it. It seems also to be for harmonizing and clears damp heat.
Okay, let's question mark stomach 44.
Question, yeah.
Yeah, but I like the large intestine 11 makes more sense for me for
sense. Yeah.
Bring it like lower abdomen.
Yes.
Okay, then obviously this is going to be acupuncture, reduce.
Ring 4, ring 12, stomach 36, stomach 20. Yes.
And
treatment principles is to relieve pain
and heat
and expel heat. And then we said, like you said, Angie, acupuncture reduce. And then you do ring 12, ring 4, stomach 36, stomach 25, stomach 36, you do bilateral, including Sanjal 5 and large intestine, they'd all be bilateral.
Yeah.
And then, yeah, I think that's it.
Okay.
Anybody think of anything else?
I would think. Now, what do we think is the cause of this heat? Do we need that? No.
I don't think so.
There's no obvious cause. I mean, there's no
obvious. Yeah.
Yeah, so like
and so the chief complaint is pain in the lower abdomen for 3 days.
Correct.
Abdomen for 3 days. And then basically pain, 3 days ago, there was pain in the abdomen and around the umbilicus. No obvious cause. Associated with constipation and bloatedness. There's no hiccups or no belching, no sweating, no fever, no chills, no vomiting, no nausea. Nothing gave relief. Yeah, I think that's anything. I mean, is there anything else you guys can think of?
I think that's everything.
Okay.
I can't think of anything else we've sort of left out.
No, it's quite straightforward, unless we're totally missing the
I'm
mark.
sure we're totally missing something. I don't know. Could be.
Okay.
Okay, let's hear what Dr. Hu has to say.
Okay, guys, I see you quite quick.
We decided we
We'll
better
see.
be
That
quick.
can be a good
We're
and a
supposed
bad
to be
thing.
5 minutes.
Yeah. You can see very many patients in a day in this way.
Oh, we hope so, Dr. Louis. From your lips to God's ears.
It's great. So just present the case first.
Okay. Who's going to present? Should I do it?
All right. I'll go. Shan,
Okay.
it's okay, Ange, I'll go. All right, so the chief complaint is pain in the lower abdomen for 3 days. Present disease history is 3 days ago. The patient started with pain in the abdomen, lower abdominal pain, and around the umbilicus or the belly button. Rated, oh, I lost my rating.
3 to 4.
Yeah, 3 out of 10. No obvious cause. The pain is described, the patient describes feeling bloated and is also associated with constipation. There are no hiccups, no sweating, no fever, no chills, no nausea, no vomiting. Nothing brings relief. Patient has a poor appetite and other modalities are normal. The patient has a red tongue with a thin yellow coating and pulse is slippery. Diagnosis is abdominal pain, and the syndrome that we got is excess heat. Differential diagnosis, we said acute abdomen, which includes conditions like cholecystitis, appendicitis, which is usually associated with acute nausea, vomiting, perspiration, severe acute abdominal pain, sometimes collapse. The other differentials was dysmenorrhea, but the patient is not on their menses at the moment. Other differentials is things like irritable bowel syndrome, where there's a tendency towards chronic constipation or diarrhea, abdominal discomforts, normally related to foods, which in this case there doesn't seem to be. And there's normally a chronic sort of predisposition. And then another important differential, although this is quite acute, is to just also rule out any form of malignancy where there might be, chronic diarrhea or chronic constipation, weight loss, night sweats, where there's wasting and other symptoms. Then we said for the treatment principle is to relieve pain, relieve abdominal pain in this case, and expel excess heat or expel heat. Our prescription is REN 12, REN 4, stomach 36, stomach 35, and then our distal points are,
25. Yeah.
sorry?
Stomach
What did I say?
25, not 35.
Sorry, stomach 25. And then our distal points are Sanjar 5 and large intestine 11. And then that was it. I don't know if I missed anything, Dr. Hu.
Okay, great. Thanks for the presentation. I think it's quite good. For this case, the present disease, also in your consideration, what you need to do or to clarify is the differential diagnosis is stomach ache or abdominal acute abdominal as you said, and dysmenorrhea. All these are correct, but one symptoms are important in this type of patient is rebounding pain. Okay, you need to exclude because these are also one of the to determine this acute or how severe, how critical. Do you need to send the patient away for these or not? Okay.
Dr. Hu, when you say rebounding pain, do you mean when you do the clinical examination?
So
Yeah.
you need to highlight it as the no, because from the negative symptoms,
Yeah.
you need to highlight these because these are actually indicate the inflammation.
Yes.
Yes. And also for Dysmenorrhea, yes, that's correct. You need to exclude. How about if this patient have pregnancy?
Yes.
Okay, pregnancy, you need to exclude. Also, before your treatments, you need to ensure it is not due to pregnancy. And also, if this is pregnancy, this become emergent.
Yes,
Yeah.
because of ectopic
Yeah.
pregnancy.
Yes. And also sometimes if the pregnancy is in a tube,
Yes, ectopic.
yes.
Okay.
And also to perform the treatment, because you see, if the patient have bowel movements a few days ago, did you ask or not?
I did ask what the bowel movements, and then you just said that she's constipated, but we didn't ask how long ago tummy worked.
Yes, you need to ask how long ago, because if you want to promote the circulation or promote the bowel movements, you need to ensure it's not pregnant. Because if on a pregnant patient, you need to be more careful.
Yes. And there's certain points then you can't use either. So
Yeah. Yes.
Yeah.
And also either the stumps in the kidney.
Okay.
You can say that one.
Yes.
I think these are the most common and important diseases. Just so for this case, it's not difficult to treat, but it's difficult to ensure your safety. So you need to exclude all these emergency. Then you can treat the patient.
Yes.
Yes. And for the points, the one you mentioned, you can room 4. Basically, we don't really use them that often for abdominal pain. You can use because it's the local points, but we don't really use it often, especially if not due to deficiency.
If it's not due to deficiency.
Deficient, you can, because room 4 is
Or deficiency.
the
Okay.
the characteristic of room 4 and room 6. They have the characteristic to reinforce.
Yeah, more nourishment.
Yes.
Okay, so they are more for different. So you wouldn't really use REN 4 in this case, really.
And
Okay.
actually, you need to think about when was the bowel movement. So for abdominal pain, for this situation, no matter what was the cause, maybe induce bowel movement first, if constipated.
Okay.
And
So
also
then
in
we would
your
correct with Sanjal 16. Would you recommend that we do this
Sanjal 6 and stomach 35,
I mean,
it's
25?
25.
So we wouldn't then have to use Sanjal 16, Dr. Who, if we do stomach 25 then.
You can use both.
Okay.
Okay. And then in your consultation, when you ask how about is the patient on menstruation, then I said no. You need to clarify when was the last period.
Okay.
It's also we
And
have
that
you
will
to
also help with
determine
the
the pregnancy.
pregnancy. Okay.
And also don't forget the low C points. The stomach 36, 35 or 37. The low C points of the large intestine.
Large intestine.
That also should be used here.
Lowest C of LR. Okay. I think it's stomach 37, if I'm not mistaken.
Yeah, 37.
I must just double check.
No, you're
Yeah.
right. Stomach 37.
So these correspondent to the lower abdomen. Yeah, correspondent to the large intestine. Great, we're done. And then if you want to reduce heat, it's similar to before, you can use some points to reduce heat. If you think this is not that critical, you don't have to. Because for this type of case, patients suffer from abdominal pain. The most important is to regulate the qi and blood circulation. How to do this is to firstly induce bowel movement first,
Okay.
or just to regulate these, especially if the patient has constipation.
Okay.
So under treatment principles, we're going to say induce bowel movement as one of the first treatment principles.
No. I mean,
Okay.
you're going to reduce heat, activate qi and blood circulation.
Okay.
And then induce bowel movement can be the last.
With that we write in our treatment principle.
Yeah, you can add those to there. Can just
At the
be
end.
complements, but you can't use it as a standalone.
Okay.
Yes. So do we use that point LI11 then? No, we're looking for rather the stomach 37.
Yes, stomach 37 is better.
Better.
Okay.
Okay.
Yes. And large intestine 11, if you want to use them, because for this, if you diagnose as SS heat, then you can.
Mm.
Because you see it's large intestine directly in the meridian, and also
Yes.
large intestine 11 can reduce heat.
Reduce heat.
Okay,
So
so
it can be used, so it's not wrong.
You can. You're not wrong. Yes. Yes.
Okay.
we'll be correct with the syndrome, Dr. Hu, with excess heat.
Yeah. Yeah.
Okay.
Is it for abdominal pain for all type of for most of the diseases, either excess or deficient? Excess can be excess heat, stem heat, phlegm heat, the common ones,
Mm.
or stagnation, and deficiency, yang deficiency, qi deficiency. If you think from this perspective, all diseases you can categorize into different. I mean, you can put them in different blocks, and it's
Blocks,
easy for
yes.
your consultation.
Mm. And we don't always have to say an organ, so it's just excess heat. We don't have to say excess heat in the large intestine.
You'll be better, and then you actually have to, because otherwise, how can you how would you treat the patient?
Mm.
Because this is not in the stomach.
Yeah, and because if it was in the small intestine and we had heat, then we might have bladder symptoms. Right. So you can clarify and say excess heat in the large intestine. That's not wrong.
That's actually correct. That's actually will be the standard answer.
Okay. All right.
And just a stupid question, Dr. Hu, the lower jowl, does that include the colon? Would you be able to say lower jowl? Is that more bladder and kidneys?
Actually, we depends on what you refer to. You include large intestine. If you think low judge from the location, I mean if the location including large intestine, bladder, liver, kidney.
Mm.
And
Okay.
then from the function perspective, it's not included, but from the location perspective, you include it. And sometimes in the treatment or in your critical thinking, we actually combine all these together.
Okay.
I see in some of the books that the liver is included in the lower jaw, and in some of
In
them
the lower
that
jaw.
middle jaw.
In the lower jaw.
So it's
Okay.
definitely lower
Yes.
jaw.
Yes. When you mention middle jaw, mostly we refer to stomach and spleen.
Mm.
So even the gallbladder would be considered lower jaw because it's related to the liver.
It's in lower jaw, but we don't really refer to gallbladder to any
To anything in lower jaw.
Yeah.
Yeah. Okay.
Okay.
All right. Just a question about the tutorial, which is due the next time. So our virtual case 7, the date looks like it's a Friday. Is that correct?
Next week. It
It's
should be
next,
it should be Thursday. Your
yeah,
Friday
it's
will be
not
the
next
PG
week.
one.
It's not next week. It's like the
The
15th
week
or
of,
something. It's
No,
it's
the
still a few,
15th
yeah.
of May.
I mean next week or the week afterwards.
no. It's
So the
like
week
3
after.
weeks away.
On
Yeah,
the
it's a while.
15th.
It's a 2 weeks
It's
break.
like it's these 3 weeks.
Yeah,
Okay.
it's written
It
as the
should
15th
be
of May.
50. It should be 14th of May. Sorry.
Yes,
So
that's what we
Okay.
thought. So
That's what we
okay,
were
so
worried
14th
about. We
of
thought it
May,
was
and
a,
then it's Thursday. And then the tutorial is also due then also on the Thursday or on the Friday?
yeah, you can just submit as a document on
As a
the
document.
date. That's on the learning guide. Doesn't really matter because
Okay.
what we need to for it's the 14th of May.
14th of May.
yeah, because the 15th of May is a Friday. So
We need to postpone this as well then. How about 20? Do we have 21st of May? Let me just open the learning guide. Because 14th of May I will be in China.
Oh, okay.
There is already a virtual case presentation 8 booked for the 21st of May.
21st.
Shouldn't we make it earlier then? Should we make it earlier in May?
Let me just open the learning guide. How many? We still have a few, right? Because this is the 7th, so we have 2 more. The last one
No, this was the 6th one, so we've got 3 more.
is 6.
Yeah.
The I think still 2 more because the last one you will be right up by yourself. It, I'm not sure the 9th or the 10th you will be right up by yourself. Let me see.
Should we not just do one next week then if we don't have to worry about the 14th?
Let's see. Can you do it next week? Are you available?
Yeah,
If
I
it's
can do next-
possible, Dr. Hu, can we maybe do it a little bit earlier again, if it's possible, with
Next
everyone,
week. Okay,
please?
let me see.
Just because of my daughter's netball stuff.
Your next week, 30th. Yes, can we start at 1 o'clock again?
If it
Yes.
suits everybody,
Yes, that's fine.
super.
So that's next Thursday on the 30th.
Yeah, and then how about the 7th of May? Are you
Oh,
guys
I don't know.
available?
The
Yeah.
7th of?
May.
I am also Dr. Hu, but also only earlier because my daughter's got her D2 finals for that day.
Oh, that's fine for me. As long as you guys agree, then we can.
Okay.
Yeah. I'm happy to do 1 o'clock on the 7th of May as
7.
well.
So
Okay,
we're
so
going
for
to
next
continue
one
2
after the
weeks. Yes.
7 and 8, one after the other. That's perfect. Okay.
Yeah, and then we will finish it 7, 8. Yeah, we have 2 more, and then the 9th you will just write up by yourself. I will tell you why, because that case is, I think it's just for female infertility, just going to give you male or female infertility, just to give you some. It's similar to a very brief briefing for the this type of disease, how to treat these.
Okay. And then Dr. Hu, that tutorial that we have for on irregular menses that Ange asked you about the other day, is that just basically writing the lecture that we do with you, rewriting and restructuring it in a way, or do you want us to reference sources and all sorts of things?
You don't need to add references. You just kind of summarize.
Okay.
Yeah, and then is this not the 7th case? It's the 6th case.
This is I thought this was the 6th one, but maybe I'm wrong. I'm
Oh,
sure
yes, the
it's-
6th. So we still have 1, 2.
3.
Yeah, we will still have one similar case to today, and the last 2 will be briefer.
Okay.
Okay.
If you don't take case, then we can actually put them into one because that's just for infertility.
Okay.
Is
So-
there still
so-
going- is there still
alright.
going to be a case?
So
for
next week
irregular
we will have
menses?
a one similar to now, and then the one afterwards we will see. Maybe we make a 1, 2 together, and then you write up 2 cases.
Okay.
And we're done.
Perfect.
All right.
And what
Oh.
else did we want to ask Dr. Hu? There was something else. It was the tutorial, the date. Was that everything we needed to?
I think it was just those 2 things about the date.
Yeah.
Okay. I'll write it on the group just to confirm the time and that it's been moved as well, so that Marisa can see it as well. Okay.
Yeah.
Great. Thanks so
Oh,
much.
yeah. Dr. Hu, I remembered what it was. Do you know when we'll get the marks back from our virtual cases that we've done, our first 3?
I will try.
Okay. No pressure. We know what it's
Thanks.
like.
I'm so confused. There's so many assignments.
For sure. No, I
So-
doubt. I know exactly. So don't worry. There's no pressure from our side.
Okay.
Great, sure, no worries. But you don't need to worry too much. Because for these assignments, most of you get around 90.
Yeah, I'm just a bit worried that I didn't write enough. When I saw the allocation and stuff, I was just worried that my info wasn't enough. That's more what I'm worried about.
Maybe you got 88, then that's fine.
I'll be okay with that.
Okay.
Okay. Thank you, everybody.
Okay,
Thank
no
you,
worries.
Dr. Hu.
Thanks. Have a good
Thanks,
afternoon. Bye.
Bye.